Africa is estimated to have more than 60% of the world's HIV/AIDS infected population. Gallup's Africa regional expert weighs in on Kenyans' perceptions of the disease. In 2005, 140,000 people in Kenya died of HIV/AIDS. And in 2006, there were 1.2 million reported cases of HIV-infected people in Kenya. With little emphasis placed on sex education and a stigma surrounding sex, the epidemic continues to spread in the region. I sat down with Gallup's Africa regional expert, Bob Tortora, to discuss public perception of sex and HIV/AIDS in Kenya and the surrounding region. Now, Gallup polled in Kenya recently, and looking at the numbers, I'm astounded that 13% of people don't agree that having sex with a monogamous, uninfected partner is a way to reduce the chance of getting HIV/AIDS. And 18% disagree with the fact that a condom should be used every time someone has sex. Now, to me, as an outsider, I think that this number should be at 0%. So is this high for Africa?
Well, I don't think it's high for Africa at all. We asked those same series of questions in Nigeria this year, and we got very similar numbers. For the monogamous relationship, 15% of Nigerians said they did not agree that that was a way to reduce transmission of HIV/AIDS. And for using latex condoms for safe sex, 24% of Nigerians disagreed with that statement.
And what about gender? I know when I was in Africa, I noticed there was a lot of differences between men and women and what they think is acceptable when it comes to sex, basically. 19% of men disagree that a way to prevent getting HIV/AIDS is by only having sex with a monogamous, uninfected partner, but only 8% of females disagree with that. So why do you think that there is this difference between men and women?
I think it's a cultural thing that men are more macho. And so to use a latex condom is not it reduces their male status.
Well, it also seems like the younger you are, the more aware you are of how to transmit HIV/AIDS and how to protect yourself, because the older the Kenyan, the more likely it is that they are uncertain about the use of condoms or how to use the condoms. So how does age play a role?
Yeah, I think it definitely does, and I think actually that's a positive sign. Some word is getting to the young people that there are ways to prevent the transmission of HIV/AIDS.
Bob, I know that you and I in the past have talked about how religion plays a role in sex education. How do you think that religion could help play a role in educating young Africans about sex?
Sub-Saharan Africans have the highest confidence, the most confidence in religious organizations. So if religious organizations can step forward and talk about this issue and talk about ways to prevent it, I think it would have a tremendous effect on the opinions and practices of Sub-Saharan Africans.
I'm Yasmin Vasugian, and join us again to hear more voices from around the world.